are listening to another episode of Perfectly Imperfect. Hi, Val.
Hi, Dr. Houssock.
How are you, honey?
I'm great.
Welcome to the Perfectly Imperfect podcast.
Thank you for having me. I'm glad to be here.
Those of you who are watching on video, we have this awesome new setup. We hope you love it.
I do.
Val loves it.
I love it.
Val and I were, well, all of us, before we had this setup that we have in right now, we were sitting in different rooms right across the hall from each other. Yep. So, and, you know, this is all, we're all growing. A lot of this stuff takes some growth, and podcasts are one of the, many things where you have to grow and figure things out. And so we're very, very excited to be sitting across from each other.
It feels right.
Yeah,
it just feels right.
I mean, she's actually a little too far from me, to be honest with you. I'm normally very close to Val when we're working side by side, but that being said, this is much better than staring at a screen and pretending like we're chatting.
You just put me in a room.
Yeah, just lock her in the room. Yeah. So now we're in the same room. This topic, I feel like we say this a lot, but Val and I is very near and dear to us because we both have experienced it. So we are talking about life after breast implants. And I think this is like it's a great topic for so many reasons. I think one of the reservations about getting breast augmentation is, am I really going to like them after? I'm nervous. Like once I do it, like, what's it like? Am I going to enjoy them? What do I need to know? And then not just like the hard and fast like rules, which of course we'll go through, but just generally, how have they integrated into our lives, right?
Right. Big change.
Yeah, it's a big thing. And like doing any aesthetic procedure is a big life-changing thing in the sense that much of what we do, maybe not breast augmentation per se, but some of what we do is permanent. There's no going back. And while maybe technically augmentation is not one of those, it's still a very big deal. Mm-hmm. Comes with pros and cons. And I think sometimes like some of it, you just kind of like learn on the fly. And so because we've both been through it, it's very easy for us to talk about it in a personal way, but also in the professional way.
Absolutely.
Right?
Definitely. So
how about you, Val? Like, let's start with like when you had yours done, how long did it take you to feel like they're like, you didn't notice them, like they were your boobs? They're not just like something crazy that you had done. When did it like kind of hit you like, oh, I actually don't even notice them anymore?
I would say it probably took me a good 6 months to really start to feel like they were a part of me. And not to go too much into detail quite yet, but I'm under the muscle. And so Dr. Houssock is above the muscle. So we'll talk about that in a little bit, but the recovery is also different. And I feel like with me going under the muscle, it definitely took some time for them to settle naturally, them to not really impact my exercising, them to sit naturally enclosed. So they definitely were very high and tight at first, but I would say about a good 6 months for sure. Yeah. It took me to like really feel like they were like a part of me.
And that's about right. When you think, and the reason why she mentions it does matter. If you are under the muscle, you have to keep in mind that the pec muscle, which is the muscle that we place these under, the pec major muscle, pec minor stays on the chest wall, on the rib cage, and then the pec major is what is lifted to place the implant. And so if a patient has them placed there, we literally are on your rib cage looking at the floor being the rib cage and the ceiling being the pec major. And it just so happens that because of that plane and the fact that the muscle is getting affected, everything stays a little higher, tighter, squarer at first because what you're seeing from the outside is the pec muscle. The pec muscle has been, for a lighter word, it's traumatized. So when you have an implant placed under the muscle, the pec has swelling, everything's kind of tight, it's crampy. And so at first, your implants really sit pretty high. Generally speaking, when they're placed above the muscle, you still are going to have swelling, you're still going to have some tightness and even some highness, but it isn't at the same level as those who get them under the muscle.
I agree.
So one of the things that I talk about, because for my patients, for the most part, unless I'm doing a lift, they do go subglandular or above the muscle. There is a little bit of a speedier fluffing, if you will. We call it fluffing. I have no clue where that came from, but that is in the world. Like we call them like dropping and fluffing. Like I guess the idea is they're like a pillow and you're like fluffing it up, but they're not fluffy. But that's the concept. They take longer to quote fluff when you go under the muscle. There's nothing in the end, the results, if you were to see somebody who's above the muscle or below the muscle, it's really hard for you to tell once they're all done,
Yeah,
but
I
they do
agree.
take longer to settle. So, Val saying 6 months isn't so shocking. I would say mine was closer to feel like they're really mine. It was a couple of months, maybe 2 to 3 months. They felt like they were a little bit more like myself. And again, mine are above the muscle. So faster recovery with how they quote feel and fluff.
I also was at that time in my life doing a lot of CrossFit.
Mm-hmm.
So the surgeon that did my surgery did say that I had a very thick
Oh, that
pectoralis
matters.
muscle.
That matters.
And so, and she said to me, she's like, Val, it's going to take some time for them to really settle.
Yeah.
For
yeah.
sure.
Yeah, for sure. And that does matter. Man, is it hard to get underneath that pec muscle when you are somebody who has a really well-defined one. It actually sometimes even limits what size we can put in. But
Yep.
but
and it did.
anyway, so that's one of the initial, like, when do you feel normal? And honestly, I would tell you just to really broad spectrum it can take up to a year.
Mhm.
Any surgery takes time to settle. There is no immediate gratification operation in the world. I get crazy when people talk about these like speedy recovery, fast recovery. I want you going out to dinner the next night. And that honestly drives me nuts because I think it's a marketing ploy. And okay, I'm glad you could go out to dinner, but also like, thank God you didn't trip and fall because you were on
Right.
medication. Like, I'm not one of those who's going to tell you, I want you like living your normal life in 48 hours. Like, that's not happening. Sorry.
You need that
That's
recovery.
yeah.
Give
So
your
like,
body that time.
don't think that, and there's no surgical skill that can make your healing faster that you would be out to dinner that night and be fine. I'm telling you, it's crazy. But anyway, so there's going to be a time period of healing. And I usually tell patients to be out of, your basic day to day for at least a week if we're doing just a simple breast augmentation. And then it's 4 whole weeks in my hands for if you are like trying to get back into major heavy lifting, heavy sweating. And honestly,
But
depending,
it flies. It
yeah,
goes by so fast.
it doesn't it? Like,
It
talk
really
about that,
does.
Val. So
It
like,
really does.
you're told 4 weeks of no exercise, right? What's your first thought on that?
I was bummed.
Yeah, yeah,
I was super bummed because
Yeah.
I was like, I was getting married. I was in the best shape of my life. I had just finished RP strength. Shout out RP.
yeah.
Changed my
No,
life.
I don't know if you could do that if they haven't they haven't sponsored us.
So I lost all this weight and I was feeling really good about myself. And then I had to take a break for 4 weeks. And I was like, gosh, I really don't want to. But I'm glad I did
Yeah,
because it gave my body the time to, take that recovery. And when I was cleared to go back to working out, yeah, it took some time because
Yeah.
it felt a little odd at first
Different.
doing upper body stuff. But
Yep.
like, I actually felt stronger going back
yeah,
after taking
because you
that
gave
break.
the time. Yeah,
'cause
totally.
I gave the time. And I feel like recovery is a big, important step in building muscle and endurance and all that. So I'm glad I had that time to just really relax and, take that time. So
And it's not just the lifting and all of that. You have to keep in mind that your body only has a finite amount of energy that it can expend in a daytime. And if you are using half of it to work out, then that half that you could have been using to heal is not being used to heal your body. And so that leaves you opened up to infections, seromas, longer healing times, bad scars. The more you allow your body to heal and do what it needs to do, the better the result. It's not just like, oh, as long as I'm careful, I'll be fine. It's the energy that you're expending.
it's not worth it.
No, you want to have the best result possible. So 4 weeks is not a whole lot to ask. I want you walking immediately. So I ask you to go ahead and do your walking. Walk as much as you want. But it's you really got to take the time to take the rest. And your body will tell you that it needs the break anyway, but at the same time, you need to kind of be smart about it. Let's talk bras. So this was fun for me. One of the things
too.
about the bras before I had my breast augmentation, I was wearing the typical bombshell, like Victoria's Secret padded bras, like
So much
underwire
padding. So much
padding. Like,
padding.
I had no idea. I thought that was like just normal. I worn them my whole life. And then when I got my implants, we were in sports bras. So I have patients wear a soft supported bra for 6 weeks. And I remember going back at one point and being like, I'm just going to see what these bras look like. Like, what does my Victoria's Secret bra look like now that I
With
have
implants
my
in?
implants in? So I'm like, before I throw this entire drawer away, which was like, dude, you guys all know how expensive those Victoria's Secret bras are.
expensive.
And I had like developed over the years because I didn't get my implants until I was in my 30s. So I had tons and they were nice, beautiful. Anyway, throw it on and my boobs were like in my chin. And I was like, so I guess these bras are done. Guess I don't need to wear these anymore.
And how uncomfortable was
Oh
underwire?
my gosh. Terrible. So what did you wear like immediately after? And then what did you like get yourself into as things healed?
So immediately after is the surgical bra that buttons in the front, super comfortable, good amount of support. I did that for a couple of weeks. And then after that, I switched into Under Armour sports bras
Oh yeah.
because they fit so well. They give you good support. And after that, I haven't gone back to underwire since 2018.
No. And I think there's two reasons why there's no like the underwire thing is kind of out now. Maybe it's the world I live in, but I don't know that underwire is even in at all anymore. Like I feel like all the commercials and things I see are like, even if people need push-ups, they're being pushed up in a different way. So like somebody comment on the bottom about that. If you guys can tell me like, what are people who are trying to do like a push-up type thing without implants? Like, what are you guys wearing? Are you still wearing underwires? Because we haven't seen underwires in a long time.
Like I said, 2018.
Yeah, and nobody goes back to them. Like nobody. Like we wear cute bralettes now, and like if you want some more like push up and support, you can obviously get some more support. But like your implants kind of give you what you need.
They really do. It also doesn't feel comfortable to have
Yeah.
something digging underneath there.
No.
My incision actually is around my nipple, not underneath.
Oh yes.
So even though I don't have an incision under there, to wear an underwire bra still does not feel good.
Mhm.
So our incisions here are under the breast in the IMF area, so the fold.
Yep.
And everyone who has an incision there definitely says it's not comfortable wearing underwire there.
Yeah, totally.
all.
So we fell upon these Under Armour bras because, and you know, again, we're not sponsored, so you know if they're listening. Anyway, so when I had my augmentation, I was like, all right, like it's just the one spot. Your incision is right at your inframemory fold, and when you think about any bra, that's a spot that it like digs in. And so I don't even know. I think honestly, now that I look back, I think I went to the Under Armour like warehouse sale while I was recovering. They had these seamless bras. They're called the Under Armour Seamless or the Under Armour Long Line. They still make them. And what I love about those bras, so these are the things that I like about it. So it doesn't matter if it's Under Armour, but so if you find it, this is the kind of bra you want. And I mean, we'll link to that again with no obvious advantage to that. I'll link it to, and we'll have it in the show notes. But
Because we love it.
it's a very thin strap here, so you can still look really cute in like tank tops or whatever you want while you're healing. It's not a big old thick sports bra. And the bottom part is a seamless band about like 4 inches or so underneath. So there's no digging. It's longer so that it kind of supports, but it still comes down in a V. It's super cute. So it really fits well underneath all types of clothing, even cute clothing, which ultimately you just had your boobs done. Like you don't want to be having to like wrap up in like a crazy sports bra. So I love those bras, and I've never found anything as good as them for recovery.
No.
They don't have any buttons in the front or anything like that. But like by the time you're in that, which I usually tell you, you know, something to kind of button for the first week or two. After that, you're allowed to use your arms. And that's one of the things we want to talk about. Like, how should I be using my arms? When it comes to this surgery, I don't need you necessarily. I call it the, yeah, the T-Rex. I don't think you need to T-Rex it, but you do have to be careful about how much you do. And if you're going to lift your arms, which is fine, you just have to do it. I always call it doing it deliberately, meaning like be slow and steady about things. Don't pull something quickly, because I've worked on your pec muscle and your pec is connected to your arm. So you just want to be careful. You just want to be careful. So yeah, that's bras. And then, you know, long term, I always say by 6 weeks, you might go braless. You may want to. And I don't care if you do.
They have great pasties out there.
Yeah. So like show off the boobs. By 6 weeks, you can be braless. But before the 6 weeks, I want you in a bra night and day. I think it's really important.
It feels good too.
It's good for support. I don't need it to be tight, but I need it to be supportive. It's soft. There's a stitch that I use right at the inframemory fold at your incision that holds your implant up while it's healing, and that suture goes to the rib cage. And that suture is just a suture for the first 6 weeks. And then by the time you get to 6 weeks, your body has started to heal that area where it's okay to not have so much support helping it. And that's why that's kind of my time period for, you know, when you can go out and do, you know, I always say, you want to go out one night and have like a cute little dinner out and you don't want to wear a bra and it's in the 6 weeks, as long as you're not like going on a trampoline. then like, fine, go ahead, but be careful.
Yes.
Oh, trampolines remind me of bouncing, and that reminds me of sex. So I have a rule about the breasts being mine for 2 weeks, and then they can be your spouse's or significant others after that. So for the first 2 weeks, no sexy time, no touching my work, looking from afar. And then after 2 weeks, I do say sex is okay, but we call it the starfish. And that comes after a patient who said that. And I thought it was the best thing in the
It
world.
really was.
If you can understand and picture a starfish, that's the kind of sex you're having. You're not getting into your, swings yet or anything like that. You're just having very simple, very boring missionary sex. And still those boobs are kind of like carefully on limits. So like still be careful with them during sex. But at 2 weeks, I do start allowing you to massage them. So, I mean, listen, foreplay, during play, that's fine.
Yeah.
If that's
I'm 7 years post-op and I still massage mine.
Yeah. So,
Keeps
that
nice
can be
and
part of be part of the mix. Speaking of sex, you were with Kevin when you got them, right?
Yes.
So what did Kevin think of your boobs? How about let's go through this. What did Kevin think before, during recovery, and after? Let's go through that, and I will tell you Chris's thoughts on that.
So before, those who know Kevin, he's very supportive, very sweet guy. That's why I married him. And he was like, if that's going to make you happy, then obviously I support that. So he takes me to surgery, and before they take me back, and it's where I work at that time, and he says to the surgeon, he was like, oh, if you want to put some 800s in there and and slips her I think a bill or something. And I was like, shut up, go away.
Kevin?
Right. And so that was the before. And then 6 months later, I did not go big enough.
So, see, he was right all along.
He was right. So I went back and he was like, all right, we do 800s this time? And I was like, no, we're just going 200 cc's higher. Still supportive, still great with helping me with my recovery, helped me wash my hair the first time, because the first time was really hard for me to get my arms up because how tight things were. So he was super helpful with that and just, being there for me. And now I joke around. I'm not doing this, but I joke around taking them out because when I was pregnant, I was pumping. They were insane, and I was like, "Oh my god, this is wild." He was like, "Are you taking them out?" And I was like, "I think
so." What we've decided is that Kev is obviously a boob guy.
Yes, he is. So he is very happy with them, as am I. So yeah, overall, he's been supportive since day one with it. I love you, bub. So thanks.
yeah. It's funny because sometimes we'll have partners come in and they'll be with their significant others during these consults. Sometimes they're not. It doesn't matter to us. It's really up to you and your partner. And ultimately, I always speak to both of you. If you've been invited into the room, it means your significant other wanted you there. And so I will, if you're in the room, I'll you're part of the conversation too, because I do believe they're yours too. But at the end of the day, obviously the patient makes a decision, but I think there's nothing wrong with making that decision together if that's what works for you and your family.
Yep.
But ultimately, like I said, the decision is on the patient and what she wants. And so we'll go with that. You are part of the process. And, obviously we do care what you think.
Oh, yeah.
We may not be doing
absolutely.
it for you necessarily, but we do care what our significant others think. And I remember when I really just started dating Chris when I was getting mine done. I was already going to get them done. I think I was already thinking about it. And then we started dating and I was like, hey, you, what you doing a couple Fridays from now? I need a ride from surgery. I'm thinking about getting my boobs done. What do you think? And he was like, whatever. I remember if anybody knows my husband, he is like the most calm, collected, cool guy, like just the coolest.
He's
and so
great.
yeah, he was like, okay, if you want to, like, whatever, it's fine. Like, so he didn't care at all. And then I got them done. And then he was a great recovery nurse and took care of me. He brought the girls donuts that day, and so all
Diablo
of that.
donuts.
Yeah,
too.
oh God, they were good. And so he's been a good partner through it. And then I would say now it's funny because sometimes now is the time where I've noticed he actually does like them. I said something about, do you think my boobs are too big now? I've been through pregnancy now and breastfeeding. And so I do think they've changed quite a bit. And I think they're bigger going through that process. And I was like, are they too big? And he's like, no, I like them. I like them. I'm like, all right, fine. So long story short, it's nice to know. I mean, At the end of the day, I don't know really very many people, and I can't think of a patient that has been unhappy with their breast. And that doesn't mean that breast implant illness doesn't occur. We haven't had one of our patients yet have that. I think it's that rare. That's a whole different podcast. It is a thing. And so, since we're talking about life after breast implants, yes, there are instances where your body might not like your implants, and that can come in the form of capsular contracture, which is scarring around your implant. It can come in the form of breast implant illness, which is a lot more complicated to talk about. It's many different symptoms. It's hard for us to pinpoint. It's hard for us to study. But the way that I describe it is, I think some people just don't do well with having a foreign body in their body, much like some people can't do ear piercings and that kind of thing. So that is a thing, but it's rare enough that we haven't seen it in one of our own patients. And I've been in practice for 8 years now, but I've seen it. So it doesn't mean I haven't seen it. It's just when you figure we do hundreds of implants a year, and I haven't seen any yet in 8 years of my own. So it's that rare. So I like to say that not to poo-poo it, because I don't believe in that. I believe it's real. I do believe that sometimes things get, overdone sometimes on social media. And so you have to be very careful and just have a good surgeon that you can speak to about these things. Because if I have a patient who is concerned about that, and I have had patients come from other practices, again, I always say that's not because I did anything special and my patients didn't develop breast implant illness. I just think it's that rare. Mm-hmm. And when they come to me and talk to me about it, I always say, the only way we're going to know is by removing your implants. As long as you've had all of the other workup that your primary care would check for the symptoms they talk about, brain fog and tiredness and different things, and to make sure that there's not something else going on, because there's more likely some other reason. Mm-hmm. As long as those things have been cleared out, then the only way for us to know is to take them out, and it's not a surefire thing.
No. I mean, it's just like trial and error.
Yeah, I wish we had a lab value to look at. We don't.
Yeah.
Things that we can look out for after breast augmentation are capsular contracture, which is still rare. Depending on the implant, it's anywhere, maybe it's hard to say, about 0.5 to 1%, maybe a little bit more of patients get capsular contracture. That's a scarring around the implant. How do we diagnose it? It's feel. You can feel it. Mm-hmm. It feels hard, gets tight, can actually deform the implant. Treatment for that is not scary, but it's a procedure. And so we have to take you back to the OR, remove the implant and the scar tissue, and then put a fresh implant in. A lot of companies have warranties for that. The ones we use have a warranty for a couple of years. And then I think there's always a little bit that you can get. So there's warranties that come with the implants. So that's one thing we can diagnose pretty clearly. The other one that people worry about is rupture. So how do you know if your implant's ruptured? So saline's easy, right? What happens with saline?
It deflates.
I mean, you wake up and you literally don't have a boob. It's easy. It's like a water balloon. Mm-hmm. And the saline just dissolves into your body, not a problem. It's salt water. So you know. Silicone's more complicated because it is a really cohesive gel. And when it cracks, we have implants sitting here right here. When it cracks, it still stays in its form. And so sometimes, and many times, you don't even know that you've had a rupture. Sometimes the body will respond to it and notice it, and then you'll start getting capsular contracture or some discomfort. But because it's so hard to tell if you've ruptured, the FDA has suggested that you do keep an eye on these implants every few years with imaging. So currently, and this changes a lot. So currently, you are to get a MRI or ultrasound at 5 years out from your implants, and then every 3 years after that. They used to say it had to be an MRI, and now they've switched it to either ultrasound or MRI. So what I normally tell patients is if you are in that age of getting a mammogram, then every 3 years, add an ultrasound to your mammogram. Because unfortunately, you cannot see a rupture really well with mammogram. And also, all images aren't perfect. So ultrasound is okay, but MRI is the best way to tell. Yep. And then the other downside is that even MRIs can miss one, because we had a patient recently who got an MRI thinking she was ruptured. She was ruptured on her MRI on the right side. And when we went in, she was ruptured on the left too. So it didn't show the left. It was so early that the body hadn't responded yet, but they were both ruptured. So images are helpful. The most important thing to know is that the rupture in itself is not dangerous to you. It sounds really scary, like, oh my gosh, I have silicone. You do have silicone floating through your body. So when studies are done on women who have silicone implants, you do have silicone in your bloodstream. And that silicone can even go into the bloodstream of a unborn baby. But the dosing and the amount is so low that there is zero risk. Like, this is important because it sounds really scary. Again, I had my implants in. Val had her implants in when we were both pregnant. Yes, that's been studied, and yes, it exists in the bloodstream, but it is at such a low level that it is not detrimental to your health. So it just doesn't work that way. It's a very inert substance, and it doesn't hurt you in that way. But, it's ultimately a foreign body.
So get your images.
Yeah, so get your images. So, all right, so someone's fresh out of surgery, Val. Val makes the phone call to prepare patients for surgery. So they're fresh out of surgery. They leave us and they're on their way home. What are the things that they're thinking about in the first 2 weeks? Talk me through their recovery.
So making sure their diet's adequate, because diet's important for recovery. Staying on top of pain control. So we really like our patients rotating between an anti-inflammatory, some Tylenol, and their narcotic if they need it. Icing. It's going to be ice is your best friend for the first couple days. Give me at least 3 days worth of icing, but obviously feel free to do it longer if you need it. Taking the time to recover, like we talked about earlier, super important. Making sure you have the help if you do have kids. It takes a village during recovery, so definitely get that all lined up before surgery, because it also takes the stress level down on you, which can also impact your recovery. So stress is a big thing as well too. And making sure you have the necessary supplies at home that you might need. So like bacitracin's good to have, some gauze pads just in case, lining up another bra because after the 1 week mark, you can switch into something different. So having something else like that. And then just making sure that you have everything, all your prescriptions lined up, your antibiotic, anti-nausea just in case, and some good Netflix shows.
Yeah, no kidding. Yeah, Netflix and chill for real. Like really do that. And that's really it. It's about like TLC. It's about TLC. Yes, you're going to have some bruising and swelling. That is very normal and typical. You are going to have some soreness. And I usually say it's more like a tightness. It's not pain, but it's tightness. And I remember the first night waking up, like the wake up and sitting up the first morning after surgery.
Yes, I remember that.
Feels so tight under the incision. So that's normal and typical. And pings and pangs is very normal, like nerve ending kind of thing, zings. I remember these things like they were yesterday. Like 10 days out or so, your nipples not everyone gets this, but I did, and it was crazy. They're so sensitive because we've placed an implant in between the nerves. The nerves travel through your skin to the nipple, and so we're stretching those nerves, and so they get irritated. And my nipples were so sensitive.
Mine were too.
Yeah, like the shower head goes on them, and it hurts. It's not, guys that are listening, it's not fun.
No,
okay. Like
not
I
at
hear
all.
I know what you're thinking. Like,
No.
so I'm talking about sensitivity, and you're like, no, like stay away from them. It was like it's uncomfortable, and then it goes away. Something else that can happen around the 10-day mark, and we don't talk about it that often because it's not that common, but it is very benign. It's something called Mondor's disease. And I always say that sounds terrifying.
It is.
Mondor's disease? Like what? So when we cut the incision, we cut across veins. And when it happens, it's higher risk for those who are very, very slim with very little body fat. When you cut across the veins, they back up. And so it's okay. It's not like a blood clot. They're just very superficial veins. And so when they get cut and they get backed up, it's exceedingly painful in the vein. And it can feel like literally just an absolute sharp pain at the incision site. So much so that I've had patients who have left work and they're like thinking something's wrong. So it is not a dangerous situation. It can be uncomfortable. It usually happens around 10 days out. And it is completely benign. And the treatment is 800 milligrams of ibuprofen every 6 hours, just anti-inflammatory, and it goes away on its own. But it can be shocking because it doesn't happen right away. It's not like, oh, I wake up and like the next day I have it. It happens about a week and a half out. So if that happens to you, know that is a very typical thing. Obviously, still check in with your surgeon because we don't know that it's that until we examine you or talk to you. So like, yes, it's common, but like it could be other things. So let us be the judge of making sure that it's just something benign.
Yes, please call us.
Yes. And then, after that 4 to 6 week mark, we do let you get right back into, your exciting life. And I just say, live your life. Like I really don't give you limitations. I remember some old school surgeons talking about how they never want you to sleep on your stomach again or lay on your stomach. Like, get out of here. Like, get out of here. Like, you live your life. Like, you got these implants, live your life.
Yes.
And if they move or something happens to them, like, Oh, well, fix them. Like you're not going to ruin them laying on them. Like stop it. Live
No.
your life.
Yes.
Enjoy yourself. Do all the activities. I've had guys who say you can never do chest workouts ever again. Again, get out of here. Like
Lie.
yeah, just do what you want to do. One of the things we wanted to mention is like if you're a bodybuilder or you do that kind of thing, or even if you're just somebody who really loves to lift it for strength, you can do it with implants. These days, we're putting them all above the muscle anyway, at least in my practice, since 2017. So it's not going to affect your strength. It's not going to affect your pec muscle. The only thing you have to think about when you are a bodybuilder, you have very little body fat. So I might put you in a little bit more cohesive gel implant so that it holds the shape a little bit better because you're not going to have anything to like cover it with. So that's the only thing. I would probably put you in a little bit of a stiffer implant to keep the shape. Otherwise, you could get some rippling and that kind of thing because you're so fit. But absolutely, we have Olympic weightlifters and bodybuilders who get implants all the time, and it does not change their strength at all.
Just start slow.
Yeah.
Just listen to your body.
Yes.
And start slow.
Yep. But you absolutely can do all the workouts that you want to do. You just have to, ease into all of that.
Absolutely.
Finally, how long do these puppies last? So the old school answer used to be 10 years. That was just somebody making up a number, and we all said it because we didn't know what else to say.
So true.
We see implants now that are 25 years old that are doing amazing and fine. So here is my steadfast but very general rule. If you've had your implants and you're doing fine and you love how they feel and you love how they look and you've had them imaged and everything's fine, you can leave your implants alone. Like leave them alone. Like you don't have to get them taken out. There is some stipulations where I will tell you implants are so good now that like your body's going to change faster than maybe the implant. So you might need to lift at some point. You might want to go smaller. You might want to go bigger. The other thing that I've noticed is that some implants, even when they have not ruptured, once they get to a certain age, they start to, I've had recently where I've seen where the gel is seeping through the implant. It's not ruptured, but like these guys have been in for a long time. So it starts to seep through the shell. So my new rule is maybe start thinking about it and being aware of it around 15 years out. It doesn't mean you can't have them switched before, and it doesn't mean you have to get them at 15. But you want to be aware of it. You might want to touch base. You might want to just make sure that you're happy and that your imaging has been fine and that maybe even come in and see me. And we just make sure that everything's going well. Mm-hmm. I've seen perfectly beautiful implants that are longer and older than that. So I have a hard time giving you a steadfast rule. So just keep an eye on them.
I think that's very fair.
Yeah, everybody's different. Everybody's different. What else, Val? Did we miss anything?
I think we got everything.
I mean, there's a lot to this. And of course, if you have questions or anything, please put them in the comments. If you've got things we didn't cover about life after implants, we definitely don't regret them.
No.
I don't know. I will probably always have implants. It's not even just about the size. It's about the shape. It's about what it does for me. And my boobs went through a lot going through breastfeeding and stuff. So I know they're not what they used to be. Yeah.
I actually said to Dr. Houssock the other day, I actually like mine more now than I did before I had Emmy, because I feel like they just settled more naturally now and they weren't so like high and tight.
Yep.
And and like I said, I'm going to just ride them out as long as I can.
Yeah. I'm going to tell you, I'm going to shout out Ava because Ava, the director of our podcast, I had to ask before our podcast if mine were real or fake because mine looks so natural. So I love that. So shout out to my surgeon. I'm actually going to call it on two people. I'm going to shout out my surgeon and I'm going to shout out my son because I think my soft droopiness that I now have is from going through pregnancy and breastfeeding. But yeah, the one thing I love about, and it doesn't mean you can't have a natural looking breast when you're subpectoral, but the subglandular implant will age with you in that way, whereas it will sag with you in that way. And so people ask about how they age, like the concern, and sorry, I'm thinking about this last minute, but the concern of how they'll age. All right, well, listen, I hear you, Dr. Houssock. I could have these for 15 plus years, but like, how are they going to look? How are they going to age? I do the subglandular or the above the muscle for one of those reasons, and it's because of how they settle. You might argue, well, some people say, well, if they're above the muscle, do they have as much support? Well, you want support, but you also want them to age with your boobs. Mm-hmm. And we don't live on the moon, I say, where we have gravity. So like if your boobs over your lifetime are going to sag some, you want your implant to also. because unfortunately with a subpectoral implant, not all, but a lot of subpectoral implants will stay high and tight, which sounds super attractive in the acute setting. But if your implants are staying high and your boobs are sagging low, you get something called a waterfall deformity or a Snoopy deformity, and they just kind of fall over the implant. That does not look natural at all.
Mm-mm.
So I do like how a above the muscle implant ages because it ages with your breast.
I agree.
So that's one other thing, life after implants, just to think about. By the way, most importantly, it is not wrong to put an implant above or under the muscle.
Not
It's
at all.
not wrong.
Mm-mm.
Like, please hear me. Like, this is what I do in my practice. There are many, many, and really the whole entire generation before me, they were all subpectoral. And even some of the people who are still practicing, absolutely. It's that pendulum is just turning. And the reason why I think I'm a little ahead of the game is I was training at Hopkins at the time where it was getting really hot to do pre-pectoral breast reconstruction. And we were placing implants above the muscle on mastectomy patients. And doing it really well. And we were finding patients were doing amazing. They had much less pain. They had all these things. It was so good for them. And so when I came out to practice, I was fresh out and I was like, why would I not do this to my cosmetic
Right.
patients too, who have, by the way, more breast tissue than a mastectomy patient? So I kind of came out here at an early time. So I think that's why I personally have been doing it so long, whereas it's starting to kind of catch on now because we were kind of just starting to do that in training. So anyway, great topic. Any
Good
questions that
topic.
we didn't address, please comment below and carry on, Val.
Carry on, Dr. Houssock.
Perfectly Imperfect is the authentically human podcast navigating the realities of aesthetic medicine. Got a question for us? Leave us a voicemail at perfectlyimperfectpodcast.com. JEV Plastic Surgery is located in Owings Mills, Maryland. To learn more about us, go to jevplasticsurgery.com or follow us on Instagram at drcarehoussock, spelled DRCAREHOUSSOCK, or just look in the show notes for links. If you enjoyed this episode, please share it and subscribe to Perfectly Imperfect on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.